Assalamualaikum to Madam Roslina. I'm Nurhayati binti Tamir. YE20171083 is a group member that will first present about our report, which is the title is Enhancing Workers in COVID-19 Vaccination, the Organization Roles. Here is the content. There are 5 topics that will be discussed. First, abstract. Second, introduction. Third, literature review. Fourth, findings. And last one is references. Abstract. COVID-19, also known as SARS-CoV-2, was first discovered in Wuhan, China in early March 2020. It then spread worldwide and has sacrificed many lives. The Malaysian government intends to obtain COVID-19 vaccines through a variety of agencies and companies to vaccinate at least 70% of the population. Although the rapid development of COVID-19 vaccine is an incredible achievement, successfully vaccinating the global population presents numerous challenges from production to distribution, deployment, and most importantly, consent. This brief addresses the organization's roles in enhancing workers in COVID-19 vaccinations. COVID-19 vaccination is evident in many organizations, recognizing that vaccination campaigns of the magnitude needed and unprecedented organization actions to reach a point where all employees are fully vaccinated and to the emergence of more resilient organization after the crisis. So the keywords is COVID-19 vaccination challenges and organization roles. Introduction. COVID-19 has been declared as an ongoing pandemic by the WHO, Bedford 2020. Its first outbreak in late 2019 in Wuhan, Hubei, China, and rapidly became a global threat affecting many countries. The pandemic has resulted in a dramatic loss of human life globally and poses an unprecedented challenge to public health, food systems, and the workplace. COVID-19 vaccine development is a race against the time for scientists and pharmaceutical companies. Vaccines are one of the most dependable and cost-effective public health intervention ever developed, saving millions of lives. The chain of infection can be broken if all individuals get the vaccine and adhere to established standard operating procedures (SOPs) to prevent COVID-19 infection. Reducing the rate of infection is also able to reduce the potential for the virus to continue to mutate and produce new, more violent variants. For example, Delta variant, and also the latest one is Omicron variant. In Malaysia, vaccinations are initially distributed to the front lines in Italy, then to adults and then children. In workplaces, employee vaccination is a priority to ensure the well-being of all. Unfortunately, there are certain groups that reluctant and strongly reject vaccination. There is no denying that everyone has their own opinion. But responsible action will instead be detrimental not only to themselves but others as well. This reluctance poses challenges and may have an impact on many parties. As a result, organization roles in this matter are vital as to support COVID-19 vaccine adoption among employees by building conviction and making as convenient and costless as possible.
Assalamualaikum dan salam sejahtera saya ucapkan kepada Madam Roslina. Saya Nurhazira binti Tamir yang memegang nomor metrik YE20171082. Pada hari ini saya akan membentangkan bahagian literature review. There are many organizations of healthcare services in Malaysia, and it is divided into 2 sectors, namely public health services and private health services. In government sector, there are Ministry of Health, Ministry of Education, Ministry of Science, Technology and Environment. While in private sector, there are hospital, GPS, dentists, pharmacies and many more. These sectors have used various approaches to curb this COVID-19 crisis from spreading socially and professionally. In workplaces, employee vaccination is a priority to ensure the well-being of all. Unfortunately, there are certain groups that reluctant and strongly reject vaccination. There is no denying that everyone has their own opinion, but irresponsible actions will instead be detrimental not only to themselves but others as well. This reluctance poses challenges and may have an impact on many parties. As a result, organizational roles in this matter are vital as to support COVID-19 vaccine adoption among employees by building conviction and making as convenient and costless as possible. Most employees reluctantly to get vaccinated due to fear the clinical uncertainty of new therapeutic, be wary because of the politicization of vaccination, or altruistically believe that higher risk population such as those with chronic health conditions should be vaccinated first. Individuals who refuse to receive the vaccine are not only at risk of developing a severe infection, but they are also at risk spreading it to others because there are no antibodies in the body and immune cells are not trained to fight the COVID-19 virus. From a legal standpoint, an employer can take disciplinary action against an employee who refuses a vaccine unless the worker refuses a vaccine on realization, pregnancy and disability-related grounds. There is 4 theories about healthcare. Number 1 is according to Halabi S. A. Henrich and S. Omar 2020, one major obstacle vaccine hesitancy and skepticism among the population worldwide. Number 2 is according to Wilhelmsen, A. and S. Molinari 2017, vaccine acceptability is determined by 3 factors: confidence, convenience, and complacency. Confidence, the trust in the safety and effectiveness of the vaccine, trust in the delivery system as the healthcare system, and the trust in the policymaker. Number 3, the COVID-19 virus has been shown to be stable in airborne particles with a half-life of more than 1 hour, according to Van Dormelen et al. 2020. And the last one, according to Kevin Treatment, a manager is one the first people an employee will go to with concern or inquiries. Employees trust medical professionals, faith leaders, and their employers far more than they trust politicians or big pharma.
Hello, Madam Roslina. My name is Elfiani Solukin. My matrix number is YE20171073. Now, I will present about finding. Trust in vaccination and in the ability of organizations to communicate and to successfully deliver a vaccination program is dependent on the extent to which the organization can instill and maintain employees' confidence in the effectiveness and safety of the vaccine, the competence and reliability of the institutions that deliver them, the principles and processes that guide organization education and action in vaccine procurement, distribution, pre-authorization, and administration, the capacity and effectiveness of regulatory agencies in handling issues and communicating consistently as even areas, while retaining employees' confidence in their review processes and the effectiveness of the transparency, organization, and judgment and communication that company test. To ensure that organization actions are open to public scrutiny and that public institutions and judges reach the populations by proactively releasing timely information on vaccination strategies, modalities, and accomplishments in this segregated user-friendly and open-source format, enhancing transparency and coherent organization communications to address misinformation and the infodemic and engaging the employees when developing vaccination strategies and the form and content key communication. People who are fully vaccinated can resume many activities that they did before the pandemic. The COVID-19 vaccine reduced the risk of infections by over 70 to 90% for fully vaccinated employees, total more than 2 weeks from the following injection. COVID-19 vaccination is a safer way to help build protection. It reduces the risk of severe illness by over 90%. Yet, CDC recommends that fully vaccinated people wear a mask in public indoor settings as a company if they are in an area of substantial or higher transmissions. Evidence is accumulating that people who have been fully vaccinated have better protection compared with previously having a COVID-19 infection. In other words, if that person becomes infected after vaccination, the person is very unlikely to become severely ill. The COVID-19 vaccines reduce the risk of death by the disease by close to 100%. Besides, vaccination can reduce harmful outcomes with ICU hospitalization and non-ICU hospitalization. They are not yet confirmed how long protection lasts for those who are vaccinated. Still, COVID-19 vaccine is a safer choice for now. CDC recommends an additional primary shot for moderate, severely immune or compromised people and booster shot for certain group of people. Most importantly, none of the COVID-19 vaccines contain the live virus that can transmit COVID-19. So, in conclusion, as the recent controversy about the safety of the Oxford or AstraZeneca vaccine highlights, authorities face several complex challenges in communicating about the safety and effectiveness of vaccine and promoting and preserving worker trust in the vaccine as they are rolled out, particularly in a context of health emergency. However, while the management of this issue presents an opportunity to highlight to the public that pharmacovigilance system work, it is important to ensure that communication concerning potential safety signal is handled with both transparency and care. Communication needs to be balanced and contextualized to clearly convey what is and is not known, and to avoid reinforcing existing people's biases. It should ideally be informed by the expertise of behavioral scientists and risk communication experts. Therefore, organizations must be responsible for ensuring that all employees are fully vaccinated and to be firm with employees who refuse to be vaccinated. Using all approaches and policies through transparency and effective communications to make them aware of the benefits and necessities of COVID-19 vaccination. Employers have the right to prosecute workers to violate the obligations. In overall, COVID-19 virus are the most largest phenomenon ever happened in human history since the 2019 until today. 2 years have passed. Still, the unwanted virus remains. Thus, humans need to live with this endemic phenomenon with vaccination, new norm and SOP, with these people could live long, healthy, and safe. That's all. Thank you.